Good morning. Pat Zemer here with Magna Wave office hours on this 14th day of November 2017. All of a sudden I thought, what year is it? But I'm glad to be here this morning. I was unable to make it last week. I was out of town in Santa Barbara, California at an ozone conference. That was quite interesting, dealing with ozone and how it can be applied to the healing process and our overall wellness and with different indications. So it was a very good conference, and I enjoyed it. I enjoyed it a lot. Of course, what's not to enjoy about being in Santa Barbara, California? It was a beautiful place to be, and the weather was great, so we had a good time and a great show. So that's where we were last week. Glad to be back here with you today. If you have any questions with regard to Magna Wave products, services, training, anything like that, I'd be happy to answer those questions for you. That's what we're here for. People have various questions from time to time, so if you have one, simply throw it up here on the chat board or in the comment section of Facebook, and I'd be happy to reach out and answer that question. I do have some questions that were provided and sent to us over the last few days, and I thought they'd be good questions to answer because we have questions about these type of things a lot. The one question is, do you ever have sales, and what is the difference between hands-on training and the videos? Well, the answer is periodically we will have a sale on demo machines, or occasionally Elaine has been known to have a holiday sale, which we are in the holiday season, so some things could happen there with regard to a sale. The next part of the question is, what is the difference between hands-on training and the videos? Well, the videos cover a lot of information, everything from the history of PEMF to the science behind PEMF to protocols, how it is used on various indications, everything from small animals to humans to horses. There are a number of videos, and the content section is growing all the time with new content that we provide, either coming from these question and answer sessions or from the webinars with the various guests that we have from time to time. So there's just a wealth of information that is available in the videos. Hands-on training, on the other hand, there's always things that always amazes me when we do hands-on training, because quite often we're dealing with people who are in the veterinary field, or they have an understanding as a doctor as to what they're doing, or as an individual they've had a background in this type of thing. And but when you get into the hands-on situation, it seems like there's always questions that come up that they may be in the videos and on the online section of the training, but the way they're asked or the way they're applied, it's just very interesting how we can dig deeper quite often in the hands-on training and actually show what's going on. The other thing that we do a lot in hands-on is people like to see exactly how someone else does it, or how they will apply the device to a particular indication that they're dealing with. So it's always good to sit down and do that. And as I said, I'm always amazed at when people come away, people that have a lot of experience, and they say, wow, I just learned this, or I'm glad we got to talk about that in the area of use of this device. In the video training, you can watch something, you can learn something, and you may have a question, how would I do this or how would I do that? And there's nobody there to answer it for you at that particular time, and quite often you forget about it. But when you find yourself in a hands-on environment, then you're able to get those questions answered as you have them at that time. So they're very complementary to each other. Is it necessary to do both? Not really, but people really enjoy doing it. So I highly recommend that you come visit us. We can come to you if that's what you'd like to have happen. But to come here, and if you're looking for small animals, to do that or talk about how we deal with people, just the intenseness is very interesting. And if you're dealing with horses, we go to Churchill Downs or to a farm, treat some horses, go over the whole thing, and then come back and answer questions and deal with people and small animals. So that you do need it? No, not necessarily. Is it beneficial? Absolutely. And is it rewarding to all of us? Yeah, because we all learn from the hands-on training applications. So any other questions with regard to that, be happy happy to answer that. So that kind of covered the second. Another question we have: does the hands-on training have more learning and better than the 15 hours of video? So I think I've pretty much gone into that. Got a question here on a horse. I have a beautiful 16-year-old buckskin mare that has developed COPD. Can Hydro Wave help if nebulized and consumed? I'm looking to cure my mare over the winter as the colder air makes it much easier for her. Her COPD is caused by allergies from a fungus that grows in the grass in southeast Texas. Thanks, Melissa. Well, certainly two things. The Magna Wave can be very beneficial to help open up the lungs and keep things flowing well with good blood flow and good oxygenation, dealing with a COPD type of experience that you're dealing with. Will the Hydro Wave help if nebulized? Well, I would think when you start dealing with talking about a fungus and allergies that are there, the Hydro Wave could be very beneficial in dealing with that if you use a nebulizer device. There's several of them out there that are not real expensive. Centurion makes a device called a transpirator, which is excellent for allergies and that type of thing. And it works. It's not a nebulizer as such. A nebulizer you put on and you put the medication or the Hydro Wave, whatever you're using, and it creates droplets of air, droplets of the medication, and it goes breathing into the lungs, and it puts the droplets in there, and then they can be absorbed and do what they're supposed to do. With a transpirator type of device like Centurion has, it actually turns the water or the Hydro Wave combination and mixture into a vapor, which is then breathed and absorbed totally through the lungs and can very well work with allergies and funguses and bacterial infections and that type of thing. And certainly the Hydro Wave, with its increased oxygenation and the silver particles, which are very antibiotic in nature and help the whole process, could be very beneficial to a horse with those types of indications. To set that horse up so it can better heal itself and get to feeling better on its own. Great question. If you have any other questions, please ask them. I'll answer them, or maybe you can answer something that I'm talking about. Maureen, thanks for liking what we're doing here today. Another question deals, is the Maxx closer to FDA approval? We are considering marketing to the veterinary locations, but are not sure how to approach them as Magna Wave is not regulated, or is it? Any wording suggestions would be appreciated. People always want to know how to approach the situation. These devices are considered to be Class 1 off-the-shelf mechanical stimulation devices, not necessarily medical devices, and so that's how they're legal. That's why you can use them, because they are considered Class 1 off-the-shelf devices. Now, when we talk about FDA approval, the devices that are being worked with for the FDA approval are the digital devices, which would be the Semi, the Maya devices, and the new Wave Pro device that we've demoed and talked about. If you have questions about that, I'd be happy to answer those as well. So it's the digital devices that are actually in the process of FDA approval. Now, that doesn't mean that when devices are approved, for example, a lot of the lasers, people will talk about, I have a Class 4 laser, or I have this type of laser, and it is FDA approved. Well, it may be FDA approved in the beginning when the Class 4 lasers first started coming onto the market. They were approved for dental applications in humans, but they were FDA approved, and so people talked about that using the verbiage that it has been approved by the FDA. So the Maxx machine at this point has not been entered into or being placed to be entered into the FDA approval realm. It is the digital machines. With regard to your question, Magna Wave is not regulated. Well, it is regulated. We all subscribe to what is called a complaint-based activity of the FDA or any type of organization. So if someone were to complain or raise a question about any device, any supplement that's on the marketplace, the FDA can step in and say, we want to question this, or we want to talk about this. So we are regulated from the aspect as to how we operate. We don't diagnose, we don't talk about healing, we don't cure anything, we set the body up. help the body be in a better position to oxygenate itself, help the body to become in a better position to then heal itself, or to better utilize the metabolism is improved, better utilize the medications and the proteins that are made available to the body. But of course, anything that's utilized in America certainly falls under the guidelines and oversight of the regulatory communities in the United States, and actually the FDA or any other type of organization. So it's just a matter of discussing how it's used. People will often talk about FDA approval as a way of protecting themselves, as a way of putting up a wall. And that's the first lesson in sales. When someone, when you're selling anything, and you go out and you talk to somebody, and they say, "Oh, well, is it approved for this?" And well, no, it's not. Well, okay, well then I'll think about it. Or can you use it for that? Well, I don't know. And so that they say things that they don't want to look at you and say no, or they don't want to look at you and say I don't totally understand. They'll ask questions about particular rules or regulations as a form of setting up a small barrier that makes you have to cross as a salesperson or as a representative for a particular type of product. But it is certainly, the device is certainly used and accepted in the veterinary community around the country. Veterinary devices do not have to be FDA approved in order to be used in the veterinary market. In fact, many devices, I was talking about the transpirator earlier, is a device that was originally introduced into the equine market as a nebulizer type of device for the equine market, and then once that was perfected, it was moved over into the human market. It's called a Vapotherm in the human market, and it is FDA approved. It's a very small device that they wear in a cannula that puts this vapor into your lungs and allows it to work its magic. And the transpirator machines are larger, certainly more bulky, but that's the way that the technology came about. So a lot of things in the veterinary world that are developed that eventually end up in the human world started in veterinary do not require FDA approval to be used. That's just one of those things. A lot of people like to have things that are FDA approved, but as I talked about with the laser, doesn't mean that the laser was approved for dental work, but it's being used in the veterinary world for various and sundry indications that those devices are used on. So I hope that's clear. If you haven't, if I left something out of that, just simply ask a question, and I'd be happy to answer it or clarify that with regard to regulation and how it works. You know, there's a lot of conversation when people talk about, and this is a good area that we would love to see standardization in. When you talk about the high voltage, low frequency devices that we use in PEMF, they operate in what we call Gauss levels. And Gauss is really, it's not confusing. Gauss is Gauss. You can have high Gauss or low Gauss or intermediate Gauss. And Gauss is the energy that comes off of the device as it is utilized. And so the challenge comes into how you measure, how you understand how much Gauss is being delivered. And candidly, when it comes to these high voltage, low frequency devices, it's not easy to measure, and because it's not a continual type of wavelength. And so when you go to measure it, it's difficult to get an accurate reading. And in fact, there are not many. I've got one right here. This is a device that will adequately measure the Gauss output of the machines that are on the market today. And you hear Gauss numbers that are amazing. People will talk about, and it's interesting that some of the low frequency, low voltage devices will talk about, well, we do it 140,000 microtesla or 150,000 milligauss or whatever the situation may be. And what that really equates to, if you talk to Gauss, is a couple of hundred Gauss, or maybe 250 to 300, 500 Gauss, or as low. Many devices work in the 50 to 100 Gauss range, but they're talking about thousands of microtesla or millitesla in strength, and so people get confused. Well, it operates at 140,000 millitesla, but that's 50 Gauss. Whereas with our devices, people have used numbers like 4 Tesla or 40,000 Gauss or 20,000 Gauss or whatever the different levels are, and a lot of these numbers are just wrong. but they don't have a way of measuring them, but they use the numbers to signify the strength of their devices, and they want to talk about the device being very strong. And so these numbers are really all over the board, and we would love to see some standardization in that area to where everybody's on the same playing field as to what their devices are by having them measured. And we're working towards seeing that happen and encourage that happen in any way that it would be more beneficial for the folks out there to understand. The bottom line is the high voltage, low frequency devices do put out a high level of Gauss, and they're very effective with that increased energy, allowing the results to occur faster, to have more rapid return on your therapy so you can set the body up to better heal itself in a more rapid fashion. And that's what everybody's really looking for. When you get down to the overall strength, if someone's got a device that they say is 20,000 Gauss and someone else says 40,000 Gauss, my estimation is the healing time is going to be the same. And because there's only so much energy that the body needs at any one time, there's only so much energy that you can apply to the body comfortably. And so when you reach that comfort level, for one person may be much less intensity, for another person may be more intensity. But when you get right down to it, how often can someone deliver the maximum intensity of their device? Very rarely are our devices, our spark chamber devices like the Maxx, turned all the way up. Very rarely are they turned all the way up. If you're treating an ankle or a wrist or an elbow, something like that, you may turn the machine higher than you will if you're doing a shoulder or back or the hip or a shoulder of a horse or a hip of a dog or whatever it may be. So when you get into those numbers, it's really about the maximum amount of energy that you can apply to an area comfortably. So that's always a question that comes up with regard to the Gauss figures that are used. We have our device and we test our machines, but if we put the numbers out there, if people start talking about numbers, they're going to find that the numbers that some people talk about aren't what they say they are. But that's okay. I mean, until everybody starts measuring, or there's some regulatory board that says we all want to measure these, and so everybody, when you talk about different devices, you know exactly what their strengths are, and then you can make comparisons accordingly. So, any other questions? I'm happy to answer them. It's 9:30. I want to answer any questions that you have. I have another meeting at 10 o'clock. So if you're a practitioner, Jason's with us this morning. I want to make sure that I didn't miss a question. No, looks like everything is there so far. Another thing that often comes up, and I don't want to be redundant in this, but we talk about the waveform. Someone asked the question yesterday about the particular waveform, a square wave or a sawtooth wave or a blunt wave or whatever. The NASA study found that the type of wave that is more effective than other waves is a wave that starts, goes straight up, or goes up, and then has a very rapid descent. So that can be a square wave, as long as it has a rapid descent and it goes off. It actually shuts down and then refires. And whether that's a square wave, a small square wave, NASA found that anything with a rapid decline was somewhat more effective than other forms of wave, whether that's from a static magnet or from a sine wave type of signal that is continual. And a sine wave can be measured because it is continual. A magnetometer can measure it. A wave that starts and stops, like the high voltage, low frequency waves, as I talked about a moment ago, are very difficult to measure because they stop. There's no continual thing that the meter can accurately read. So you need a special meter that is designed to read starting and stopping signals or waves as they are tested and regarded. So happy to answer other questions that you may have. Those are the questions that I picked up that have been asked in the last couple of days that people wanted answers for. But I'm happy to answer any other questions. Good morning, Wendy. Thank you for joining us. Jason's with us. Keith Smith is with us this morning. Maureen is with us, and some other folks that haven't responded or said anything are out there watching and hopefully learning as we learn and go along. So I'll wait another 30 seconds or so to see if anyone has a question that perhaps I can answer, whether that question deals with training, devices, whatever it may be. I'm happy to answer those questions for you as we go along. Doesn't look like there's anything else at this point, so I want to thank you for joining me this morning. Let's see. Oh, tell us about the new chair. Okay. It's and that's one of these things that for years I've been doing this since 2002. Long time. But for years we had the large coil and the butterfly. And people would ask me, well, how about a blanket? How about something to do this? And I'd go back to the factory and I'd say, hey, can we do this? You don't need anything else. Those two attachments will take care of everything that you want to do. But certainly over time, people found, well, let's use a mat. And then factory did have a mat. We had a full body mat and a half body mat, and the mats are very effective. And then we always use the mat in a chair. The logic kind of was for us, let's put the mat in any chair you want to put it in. But yet, all of a sudden, there are chairs, and people want specific types of chairs. So we have found a chair that we'd like to use. Having the coils built into the chair so it can be put into a clinic type situation, the chair that as it's refined here and introduced over the next few weeks will have PEMF on the base of the chair where you sit and on the back, and so you'll be able to do almost a full body treatment sitting in the chair, and it's very comfortable, and put your feet up or whatever you'd like to do, and it's lightweight, easy to move around, and use in that application. So it's going to be very comfortable. And then, of course, we have the Wave Oasis bed that's a little thicker, that is a vibrating type of situation. We are looking to incorporate into the chair, kind of like a recliner, not only the PEMF, but we will also at one point have a chair with a vibrating pad as well, so you can vibrate and have the PEMF as we continue to develop the chair. I don't have a picture with me, or I'd pull it up and show you the chair, but we're excited about it. We're utilizing it now, and it will certainly be available for those of you who would like to utilize the chair. The other thing that question has not been asked, but was introduced last week, and that is the new Wave Pro. It is a digital device. It is between, it's a little less powerful than the Maya, somewhat more powerful, but it falls between the Maya and the Semi machine. So it's controllable, two different signals, totally independent, so you can hook up two attachments and control each attachment independently of each other. So you can set it, if you want to treat the back, you could put it on a 3 or 4. If you want to treat the foot, you could put it on a 5 and have total strength of the device. And what's really cool about it is when you hook up two devices to these machines, which you can hook up two devices to most of our machines, is that they typically reduce the power of the machine that you're delivering at any one time. With this machine, the way it works is you can adjust each device independently, but where the strength comes from is that you can have them go at the same time. You can deliver the same power out of both attachments at the same time, simultaneously, or you can alternate. So if you want the maximum power out of each coil that you're getting, it'll fire this coil, then it'll fire this coil. So it's boom, 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 and which will give you maximum power on both coils because it's going independently. Or you can do them simultaneously, so they're both going at the same time. So it really increases the amount of energy that you can control as it's applied. The other thing that is really neat with it is, for example, at the ozone conference, we were using the mat on the back, and then we would put the paddle. Let's say we had the mat up on my shoulders, then we'd put the paddle on the front, and we're just really exercising the cellular area from both directions, and the results were really cool in being able to deal with it in that fashion. The way the Magna Wave is used in the ozone community is ozone is a oxygen based. It's O3, I believe it is, as where oxygen is O2. And so they'll take the ozone and they'll put it into your body to enhance the oxygenation of the body. You can put it in through the ears. You can breathe it through a cannula if you filter the ozone through an oil, like a sunflower oil or something like that. So it's going through the oil and bubbling, and then you're breathing it. Ozone in itself is I don't want to say it's poisonous, but it will cause coughing and that type of thing, and you can't be totally immersed in ozone, or it can be harmful to you. But if you filter it through water, or you put it in through the ears to where you're not breathing it at that point, you can put it in through the ears. You can put it in what they call insufflation. It can be applied rectally or vaginally if you want to apply it in that fashion. So it's used a lot. Probably in the medical world it's used. Now, they use it for dentistry as well, to where they will block off, they'll put something and they'll use it right on the tooth to help kill bacteria and remodel and things like that. So it's really an intriguing part of the wellness and medicine world that you get in today. But that's how it's used. Now, what we do with the Magna Wave is, for example, let's say someone is going to have insufflation of the ozone. If you treat the body first and then you put in the ozone, the body is prepared, the blood cells are prepared to better accept and utilize the ozone that is put in there, which is much the same way we talk about utilizing Magna Wave with any type of other medication. But it's often used, you'll use it before, then apply the ozone, or apply the ozone and then massage if you're applying it rectally or however you may be doing it, and then use the Magna Wave over the torso to help stimulate and move and cause the ozone to be hopefully better utilized by the body. So that's how we get into the ozone aspect of things. And it's kind of thing I've talked about before, people have asked why we do supplements and why we do these things. One of the primary features of the PEMF device is the fact that it delivers energy. It charges the body, allows the body to better function on its own, and it also improves the metabolization of how the body utilizes the proteins, utilizes the blood that it has, utilizes the medications that you're applying, utilizes through the metabolization the ozone that you might be using. So, and as you travel around the world in what they call medical tourism, you'll go to Mexico and you'll see them for various indications using PEMF therapy and ozone and hyperbaric chambers and all these other types of therapies that may or may not be allowed or utilized for the treatment of some indications. In the U.S., you can go outside of the U.S., and people go outside of the U.S. for hip replacements because they can get it done for less money in another country, or they'll go for dental work or whatever. Well, people are going out for many outside of the United States to utilize through the area of medical tourism. Well, a lot of these products that they're going outside of the United States are available in the United States as supplements that people will utilize, and so we just like to have complementary things available. Yes, we believe in Magna Wave 150%, but is it complementary with other devices? Absolutely. Is it complementary with other supplements? Absolutely. And so that's how we like to just make it available so people can better utilize and really attain the wellness and health and wellness that they're looking for. So that's why we do have supplements. We have the C60 supplement. We have the ozone will soon be available through our website. We have the Ananda hemp products that are available that we're seeing a lot of success with through various folks utilizing the products within their practice if they desire to do so. We have Lubricin, which is for joints and joint lubrication. As we age, we don't make as much synovial fluid as rapidly as we need, and that's why when we go out and work in the yard, we get sore. When we were younger, we didn't, because our bodies would make synovial fluid or hyaluronic acid that's there more rapidly, and when you in an athlete, they deplete their HA or they deplete their synovial fluid, and it will replace, but it doesn't. If you go right back out and perform the rigorous stressful activity again, it's depleting before you can actually get it replaced. Hence, you have injuries and soreness. So that's why we do the things that we do with the supplements that we do have available and utilize through the Magna Magna Wave. So that's the new Wave Pro. The chair is coming. We're talking about some other applications that we'd like to apply and bring to the marketplace for the benefit of the business people that are here and for those who want to utilize these devices personally for their health and wellness. Any other questions? Happy to answer them. If not, it's been great being with you this morning. I'll be back at 2 o'clock this afternoon for another round of office hours. It's a great time. I certainly enjoy being with you and look forward to visiting again. So, ladies and gentlemen, thank you for being with me, and I'll talk to you soon. Wave on. Bye.